take you through our process as African American HIV University Fellows for 2014. So, as stated, we've done work specifically within the city of Los Angeles and Los Angeles County. And so we'll start with some of the data from our work. So as it relates to HIV in the United States, we see that this top map shows the overall rates of people living with HIV by county, and the bottom map shows the rates of blacks living with HIV by county. And so looking at these two maps together, we see that there is quite a bit of work to be done, specifically in Los Angeles County and Southern California.
Okay, so we actually have a video to tell you a little bit about the robust culture that exists in Los Angeles, but more of the Black history within LA. Hear that?
So the sound is a bit unstable with the video, so we'll actually forego the video.
So what I will share is that what the video is going over, some of the original settlers, one of the actually founders of Los Angeles were actually Black and African American folks. Over time, the city has progressed to where folks have been moved more to South LA, South Bay, but we're more plentiful and more successful and thriving when we think about Black Los Angeles. We talk about the complexities of culture and history and so on and so forth. And that's just the general depiction of the video at that time. Okay, so when we think about Los Angeles, I'm a Midwesterner. And when I look at Los Angeles, when people refer to Los Angeles, they're always talking about LA, but really what they're talking about is Los Angeles County. And when we look at our service planning areas, because we are so large, we're not looking at simply Los Angeles proper, but Los Angeles County. And you see all of these large major cities actually do fit in the county. So when we're looking at the epidemic, we're looking at this entire county and how do we approach the work to really impact this large amount of space. It's actually separated in different service planning areas, or what you will hear us constantly refer to as spas.
And so what this map shows also is just to give some context, as Shalaurey said, to how large Los Angeles County is. And so these are a number of large American cities that actually fit within the space of Los Angeles. And so we see Chicago here, Houston, New York City, Philadelphia, DC, and San Francisco all can fit within that area, and room for some other smaller cities as well.
So we think about 81 miles of shoreline for Los Angeles. We think about some of the highest mountains that you can see within the United States of America. We think about an area that has some of the most beautiful cities, Beverly Hills, Westwood, Brentwood, and also some of the most impoverished communities that are at risk regarding poverty, health disparities, diabetes, so on and so forth, depending on where you are in the city or where your spot sits, based on zip code in the city or county.
And so while that map put spatial information into perspective, now moving forward into how HIV looks in Los Angeles. So in 2013, this shows some of the data around those living with HIV. And so it's estimated that there are over 58,000 individuals living with HIV in Los Angeles County. This graph also goes to show that of that 58,000, that there are 10,500 who are unaware, and 45,500 reported cases. And then there's a pending 2,000 as well.
That are unconfirmed.
Right.
Okay, so I love this graphic because when we refer to spas, this actually breaks down the county by spot as well as zip code, so you can see where the epidemic actually lies within the different parts of the county. The areas that we focused on were SPOS 4, 6, and 8, which would be Metro, South, and South Bay, but we zoomed specifically in South, which most communities I think you'll be familiar with would be Crenshaw, Baldwin Hills, a little bit of Carson, and then down here in the South Bay area as well. So when we think about SPOS 6, LA County, 9.8% African American. 32.4% of those black folks actually live in the southern part of Los Angeles. This is where, when we talk about health disparities, it's not simply HIV. Prior to Obamacare, we had over about 35% of adults as well as children that were uninsured, right? We have the highest rates in regards to diabetes, infant mortality rates, as well as, interesting enough, mental health, right? So it's all a combination, and then it's impacting men, women, and children alike, all in this area.
And it's also worth noting too, just as a visual depiction, this graph, I'm not sure if the grid rather shows, but the lighter greens is fewer HIV diagnosis cases. The darker, the green shows more. So the white would be 5 to 9 cases, and grades up to the darkest, or almost black, 100 to 210 cases. And so we see the concentration, as Shalaurey said, is in the Metro South and South Bay, which is another reason, another driver to where we are doing work. And so just again, some more details of what HIV looks like in Los Angeles. Men who have sex with men, or MSM, actually represent the largest impacted group in Los Angeles County. Some data supporting that is that black MSM are the most disproportionately impacted. We see 17.4 of all MSM living with HIV, of those living with HIV, 17.4. We have 21.6 newly diagnosed, and as Shalaurey said, to reinforce that blacks comprise only 8.3% of residents, and we see the numbers, the disproportion among those numbers.
Okay, when we look at morbidity mortality rates and the racial inequity that actually exists within LA County, I'm going to zoom specifically in and kind of try to, this is a little bit, I think, a little bit more complex material, but when we look at people that are actually living with AIDS, that's what would be stage 3, specifically, people that are living with AIDS, not HIV. So that would be the prevalence, that's 47,148 people living with HIV. Cumulative diagnosis or new infections would be the 82,501, but cumulative, so the overall. The death rates are 35,000, so these are how many people are actually dying from HIV and AIDS. Cumulative death rates, the overall, and again, at stage 3, that what you hear referred to like full-blown AIDS years past, will be the 32,281. The most powerful point for this that I want to bring in is that per 100,000 people, we have 50 black people, 50 that are infected. That's triple the numbers of our white counterparts, triple.
And again, just to look more specifically into community, these again are some of the numbers that speak to specific demographics. We have 84% is through MSM or through men who have sex with men through sexual contact. Heterosexual sex accounts for 9%, and 4% of heterosexual IDU is 4%, and MSM IDU is 3%. And as we know, a large part of why IDU users are reported together is because oftentimes it's undetermined which form of transmission, and so they're reported together. But we see that 84% MSM is quite alarming. And just to look at some of the gender differentiations, 84% of new cases are male, 37% of new cases are among black females, and 21% of new cases are among black men. And it's always important to keep in mind the percentage of population that blacks account for. So when we see these large numbers, being that blacks represent such a small part of the community, it really puts it in perspective also.
One other popular thing about California is we are number 4 in the nation when it comes down to, out of the top 10 cities, when it comes down to new cases of HIV and AIDS for women. for Black women. We're number 4. A little bit of light in that particular darkness is that over time, between 2002 and 2011, within the Black community, there's been a decrease of about 39%. So there is some light in that darkness. There is some positivity regarding what efforts have happened in the city or in the county thus far.
So saying that, like Shalaurey said, a good part of determining where our work would go was pulling data and working with some of the existing data to see where needs were specifically. So as part of that, there was also a needs assessment. And so part of working with that needs assessment is to see what exists, what resources are there, and what needs to happen to address the needs of our community. And so some of the prevention efforts for the Black community are increased targeted HIV messaging to Black communities, a greater visibility of Black staff working in the field, and also increased and routine involvement with local communities by agencies. So overall, Black people need to see more Black people.
And it builds a sense of comfort and a sense of community when someone understands who you are and then also are providing services to you. Even in that lack of judgment and stigma that may be related to the topics that you're discussing.
So this is, again, just more thoughts and feedback around that needs assessment, just more assessments around that. So we see there's a need for increased education and testing opportunities targeted toward women, as Shalaurey said. Also more cultural understanding of fear and social concerns around HIV in the Black community. Also some more collaboration between Black institutions and organizations working with Black people. And so we see that a consistent theme throughout these needs assessment was that there was a need for more collaboration as it relates to Black people.
Okay, so our needs assessment, which we were really excited about, we did our data collection between March 17th, rounding up through April 19th, which was actually our 3-day training that we implemented in the city of Los Angeles. We did a combination of paper surveys as well as online surveys through
A
number of folks. So yes, the people that actually attended our 3-day training or conference did the survey, but we also sent it out to the Black alumni of UCLA, a lot of the staff, as well as BAI listservs, so on and so forth, to be able to take the opportunity to do so. And then we had folks that were outside of that purview and outside of the field to be able to take the opportunity to do it as well.
Another resource that we use too that proved to be very successful with data collection, of course in this digital age everybody has their cell phone, so we gave individuals the option to, if they did take the paper survey, they could have taken a picture with their phone and sent the picture of their survey to us. So that actually
it helped.
That did, you know, because people aren't trying to drive across town and bring you a piece of paper. So again, just meeting the needs, working with the community to accurately assess what's happening. And so another strong part of our needs assessment is to see, like I said, what already exists. And so a big part of what BTAN LA is to do is to meet the needs, the lack. And so part of that was to do a resource inventory, and so this just speaks to some of the things that are available in Los Angeles County. We won't go through them all, but there are a number of testing and prevention services, there are medical services, there's financial assistance, housing support. So there's a number of sources that are available, but a big part of meeting the needs of community is letting people know what's available and connecting them to those resources.
Yeah, this is probably a few bullets to about maybe 4 pages, 3 to 4 pages of resources that we have. They range from everything from pharmaceuticals to palliative care to hospice care and things just across the board.
And we do have an exhaustive list available for those who would like it. So when we began the needs assessment and of course the resource inventory, you take what we have, what we don't have, and then you have a gap analysis. And so I will read this actually verbatim because it's quite important. It says the most at-risk groups referenced are as follows: foster care, transitional age youth, incarcerated individuals, re-entry populations, homeless individuals, those in crisis, and based on the data in the 2013 HIV surveillance report, this list should also include men who have sex with men, and women of color in impoverished communities. So that speaks to a number of populations that need help. So this is where BTAN comes in, the Black Treatment Advocates Network. So a large part of what makes AHU successful is that it gears up leadership for a number of cities across the U.S. So the Black Treatment Advocates Network is a collaboration of community partners to address the need in our communities. So this is a BTAN map that shows where the Black Treatment Advocates Network is present and active. So they're in a number of stages of development. We also have some new cities that aren't here yet, but that lets you know that BTAN is growing, and BTAN is looking at cities, looking at communities, and preparing to meet those communities. So, of course, we're speaking to BTAN Los Angeles, but as you see, BTAN is national.
So we have representatives from
Of
other
those
fellows.
chapters, yes. We're very excited for that.
Okay, so this is our BTAN LA organizational chart. We have had some slight changes, but we have two awesome, very involved co-chairs, which would be Dr. Leo Moore and Greg Wilson, who's the Deputy Director of Reach LA. We have our BAI liaison, which is Gerald. For the AHU Fellows, we actually had a TA that is like a TA extraordinaire, because she still continues to keep in contact with us, which would be Danielle. And within the city, she's very active, also works at UCLA, and is our chair for the treatment education unit there. And then Derek and Gerald also advocacy. Damone is social media. Now, here's the thing, what's very specific, and what we'll talk about a little bit more within LA, is we are a lot more robust in regards to social media and faith and spirituality. And these are two unique areas that are not in the other BTAN networks that we've added along the way.
So it says, like Shalaurey said, it's worth noting that BTAN is present to meet the needs of your community.
Yeah.
And so whereas BTAN does have 4 core, key committees, it's definitely worth having that conversation with your local leadership and your BTAN leadership, as well as with the Black AIDS Institute, to find opportunities to address the needs of your community. And so as Shalaurey said, faith and spirituality is very much a strong component of the community in Los Angeles, as well as technology. And so BTAN LA saw it very fitting to create these ancillary subcommittees.
And one part of our disclosure committee, where Shani Moore is our chair, is People Living with HIV and AIDS Caucus. So whether it's folks that are going to be a part of our online act for positive moving forward, or whether they're going to participate in different panels, so on and so forth, this is the caucus that we're trying to work to develop as we move forward. And then we also have our patient navigation chair, which is Chair Stevens Davis.
And I also want to know too, Shalaurey didn't mention, she talked about some of the changes. The administration leg, I guess you could say, of BTAN, Shalaurey actually is one of the the leads in that. I say one of the because it's her.
Okay.
Okay, and so as stated, BTAN LA or BTAN chapters should be speaking specifically to the needs of their community. So BTAN LA has actually devised its own value statements, and so the value statements of BTAN LA
Productivity, accountability, shared responsibility, and being action and task-oriented. Opportunity for growth, education, and collectively achieving what we cannot do alone. Being a place where young, trans women are at the table and can connect with others who have a vision and heart for the health and wellness of our community. Committed to being in the trenches and making a difference in the community every day. But the part that I think that we all love the most is doing the work, not because it's our job, but because it's personal. We're family and we want to impact our community, and that's how we move forward as a club.
So one thing too that is very important that BTAN LA wanted to make certain was that BTAN LA didn't speak to any one group of people, in the sense of this is not a women's group, this is not a gay men's group, this is not a youth group. It should be representatives of a number of populations and should speak to the needs of these multiple populations. And so one thing that's worth noting is for the project areas, we have actually deemed or renamed our treatment education committee to prevention and treatment education, because we know that there are needs of those who aren't necessarily HIV positive that BTAN speaks to address. We have renamed the patient navigation committee to the peer navigation committee. We have renamed the disclosure committee to voluntary disclosure committee, because our voluntary disclosure committee is actually chaired by a trans woman. And so there are some initiatives in space around conversations of disclosure from a trans perspective, from an HIV positive perspective, from a coming out perspective. And so when we speak to disclosure, we don't want it to be so specific to any one person's journey. And advocacy is still advocacy.
Okay, this is just the general BTAN logic model that we all use throughout the nation.
Right, and so just again, as we geared up to do our work, it was very necessary for us to create a logic model, as we all know. And so this just tells the steps that we took as we devised our logic model for Los Angeles.
Awesome, and then this is?
So this is our BTAN LA flowchart specifically, and so this model is actually being launched in Los Angeles, and ideally will become a model for all of the other BTAN chapters. And so this is actually a presentation itself, so we won't get to, as you see, we won't get too in depth into.
We don't have time for that.
Right. But a big part of what BTAN does is to seek, test, treat, and retain. And we see, maybe we do or we don't, but this is very cyclical. And so, and this is available also too, if you would like to in more depth. But BTAN LA, along with a number of its partners, is implementing this model throughout the county, and will be coming to a city near you.
I guess the biggest takeaway from this, you all probably cannot read it, so I'll read it to you. It says the outcomes, or our main goal, our core focus would be reduction in HIV transmission, increase in access to coordinated care, improve health outcomes of members of the Black community, people living with HIV and AIDS, and people that are high-risk negatives. Okay, so this is just kind of our structure and how we roll in BTAN LA. So committee goals and expectations, everybody has to create their committees and goals moving forward, just so we know where we're going every year, and we reassess those quarterly, and sometimes it pops up in every meeting depending on what's going on. But we do know that any coalition works well and thrives well when there is a higher level of structure. So we try to make sure that we follow that structure. So we hold our monthly meetings. We also have a BTAN, we love our Google Drive because we all have access to everything at all times, whether it's the notes, whether it's past things that we've had, minutes, past things from in-services that we've held, and so on and so forth. And then we have each representative from, let's say, whatever the particular topic area group, to be able to speak to represent what's the update from that particular area at that point in time. And then what future collaborations that we have moving forward.
So one thing too, like Shalaurey touched upon, that proves to be very successful for BTAN LA, is that we have what we call subcommittee check-ins every month. And so the co-chair or representative from the subcommittees speak to what each individual subcommittee is doing. And also we have, along with our monthly in-service, which is a presentation of sorts that speak to resources, updates, policy change, things that are specific not only to the county but nationally at large. And also we have in-service check-in, which is a space for feedback and just to see what the group would like to see more of, maybe less of. And we get to see it in real time, which really makes it a lot more relative. And so these next few slides actually speak to what each subcommittee is doing as far as their subcommittee goals. One thing that our subcommittees, co-chairs rather, have tasked each subcommittee to do is to have for about 3 to 6 months, like certain projects or certain specific tasks that although they fit into the model and to the plans of the larger body, they should be doing something separately. And so each subcommittee has its own sort of tasks that they're working on, and so we'll go through these as well.
Yeah. So we have our monthly meetings, and then we also have our individual conference calls and meetings accordingly based on whatever your group happens to be working on at that particular time.
And so yes, this just speaks to what's happening as far as within those subcommittees. A lot of it outside of those particular tasks is with branding BTAN Los Angeles, working with a number of individuals and partners throughout the county as well, and also collaborating and checking in with other subcommittee chairs and the BTAN LA co-chairs.
Very similar. So focused on more HIV policy. They may represent us at the commission meeting depending on what's going on, as well as Gerald or other BAI staff. They also produce policy briefs for us depending on what's going on, so we can stay up to date.
And one thing too that is also proved to be really great is that oftentimes it's not necessarily a policy update or change, but the advocacy committee comes and presents on a policy that's already active and current. A lot of times, many of us don't quite know what's happening. We know about it, we've heard about it, we know it's in the news, but we don't know what it is specifically. And so that's been very, very helpful too. And as we know, when people can speak to something, they are a lot more to speak about it. And so the disclosure committee, as Shalaurey said, one of their big tasks is working with the people living with HIV caucus, and also working with a number of other communities to strengthen ideas around disclosure, and most recently too, working with some of the working around the stigma of PrEP. It's been a big go-to. Our Faith and Spirituality Committee.
Sure. For Faith and Spirituality, again, we also do our meetings outside of the B10 meetings, but we work in collaboration with a lot of the different health ministries, or helps ministries throughout the city. So whatever the mega churches are or smaller churches are, whether they're developing ministries or something that is thriving, we try to make sure we're connecting with them. Gerald and I have actually had the opportunity to speak at some of the churches that were open to receiving HIV information, that were and here's the thing, that it's not that folks are not open, but it's more about tailoring it to fit the needs of that particular church. And do we have the blessing of that pastor? Do we have the blessing of that particular first lady to be able to move forward? And then there's also a whole, which we won't go over, but a whole step, like 6-step process to figure out, are they ready to walk, crawl, or run?
Or just lay there.
Or just lay there. When it comes down to like how much the church wants to actually be engaged in the work. And that's what we try to work with them individually to try to figure out and meet them where they are, tailor educational opportunities and programs, presentations to where they are.
And what's been really great too, as it relates to houses of faith, is that we have gotten some resistance. And I think that's very important to take into account, because that's very realistic of the where the Black church especially is when it comes to HIV. So I know we've been able to pull a lot of experience and learning, like Shalaurey said, when we come to tailoring these messages and these trainings. You know, when we get that resistance, we've been able to use that as an opportunity to further this work, especially as it relates to houses of faith.
There are also some health fairs and things that happen within the city that we're able to hopefully collaborate with in the future. And as we said before, we plan quarterly. So we're thinking about November, December now, so that we're planning ahead and getting ahead of the game.
And so our social media and technology committee, they're very robust in moving forward. You know, social media outlets are all the rage. There's something new at least every month or so. But there's that, and they work very robustly around developing promotional material. One of our most recent charges is around a LA-specific PrEP campaign, and so that's moving forward very quickly. That should be launching July 23rd, and so that's exciting. So, knowing that what BTAN LA does, we'll speak now to how do we advance the work of BTAN Los Angeles. So Shalaurey mentioned that we do project quarterly, and actually our work has been projecting a lot further now because BTAN has become such a much more robust machine that we are looking quite forward. But just to give you some background on what BTAN has done, we reactivated in just October of 2014, and December of 2014 we announced our co-chairs and have since then been hitting the ground running. So we mentioned that our subcommittees are doing a number of projects. So one of those projects is a Los Angeles resource guide that not only speaks to HIV services, but a number of services that would be necessary for, for someone who would need that. And that
the focus is holistic health within our community, and as you look at some of our trainings, they focus on that holistic approach to healthcare, which is why the resource guide is more comprehensive.
Right, so Shalaurey spoke about mental health and heart health, and there's a number of concerns that are specific to the Black community outside of HIV, and so we want BTAN to be not just an HIV resource, but a valuable resource throughout the community. And so also too, working with some churches and some houses of faith, we have working with some First Ladies initiatives. We also are working with developing faith-specific curriculum. We're also working with the trans communities, youth. She mentioned our co-chair. One of our co-chairs is Deputy Director of Reach LA, and Reach LA works more specifically with youth ages 16 to 24, more specifically Black MSM. So there's some work with that group as well. Some of the work we've done too is working with the National Black HIV/AIDS Awareness Day. And so we've done this 2 years running. The idea is that this will be an ongoing initiative. It actually has proven to be very well. Shalaurey can give some details on Black Love is Still Safe Love.
Mm-hmm. Okay, so we had the opportunity to really just sit down and have a meal at a Creole restaurant and be able to receive modules of education about HIV and AIDS from different doctors, literally like 4 to 5 minute sessions from them, but then have roundtable discussions, kind of family style, for folks to have more comfortable conversation about the topics, and then we kind of quizzed them and did giveaways and so on and so forth. And this was led by our prevention treatment education co-chair, Danielle.
Right,
So we had this in collaboration with Magic Johnson Foundation, which helped with funding, Watts Health. So there was actually a testing van right outside. Some folks used it, not as many as we hoped for, but at least folks were there and present to be able to get the relevant education and so on and so forth. And then it was also a collaboration with UCLA Sexual Health Coalition, Black Healing Hope, and then we had a live DJ. But it was just a very casual event, but very impactful in the amount of knowledge, or relevant knowledge that was shared within the community.
And we know that's very necessary too when it comes to addressing stigma and demystification of things, to really make spaces for conversation not a scary thing. And so creating this space, this very comfortable space for people to ask questions, to not feel challenged, to be made to feel stupid. Creating these spaces is really important for BTAN Los Angeles. And lastly, the advocacy committee is not only working with some local planning groups and the Commission on HIV, but also is creating a really robust social calendar so that BTAN LA is present at a number of events. Most recently, we had LA Black Gay Pride, and so again, just to be present to let people know that BTAN